Hello, everyone, and welcome to one of our 11 Together to Goal Plank Mentor webcasts. Today, we'll be hearing from Dr. Frank Colangelo of Premier Medical Associates. Dr. Colangelo is the Plank Mentor for the Conduct Practice-Based Screening Campaign Plank. Dr. Colangelo, thank you so much for joining us today.
Thank you for having me today.
Great, so let's get started. Dr. Colangelo, please tell us a bit about you and your organization.
Again, I'm Frank Colangelo. I'm an internist at Premier Medical Associates, which is a 100-provider multi-specialty group located in the eastern suburbs of Pittsburgh, Pennsylvania, that's evenly divided between primary care and specialty care.
Great. Tell us a little bit about your process for conducting practice-based screening.
Yes, we've made this a great effort at Premier over the last several years. We have reminded our providers repeatedly that about 10% of the United States population has diabetes, but nearly a quarter of those patients aren't aware that they have diabetes. We educate our providers constantly about what the American Diabetes Association suggests are the patients who should be screened for diabetes, which includes most patients who are overweight or obese who have at least one other risk factor for diabetes, anyone age 45 or above, and those patients especially should be screened at least every 3 years. It was interesting, AMG Analytics did some work on this field and found that of patients who are newly screened, 6% of those patients are found to have diabetes, and 36% of them are found to have prediabetes. So there's a significant population of patients who haven't been screened who potentially require your medical care.
Great. So can you tell us what are 1 to 2 tips for making screening more effective?
Also, lessons that we've learned from AMG Analytics are that patients who have increasing weight, so if your BMI is above 35 or 40, those patients may have twice the incidence of diabetes than patients who have lesser BMIs. They've also found a higher screening yield for patients who have issues with social determinants of health, such as lesser degrees of education, or those patients who have Medicaid insurances have a much higher rate of showing positive for diabetes. And unfortunately, the data shows these patients with increased weight and the problems with social determinants of health actually receive half the screening measures of patients otherwise.
What would you say is the role that clinical inertia plays in terms of screening for diabetes, and how do you address this?
I think clinical inertia could play a large role here. A pre-survey that was done for the Together to Goal campaign said that 31% of the participating groups were not going to emphasize screening because they felt that they were already overwhelmed with the number of patients that they were taking care of with diabetes, let alone adding another cohort of patients to this group. This is unfortunate because these patients require our attention.
And then our last question for you here today is, what would you say to medical groups who are overwhelmed with managing their diabetes population and that don't have the bandwidth for screening for diabetes?
Well, hopefully through some of the lessons we're sharing here with the Plank Mentor campaigns, we can convince these groups that they should try to develop the bandwidth to do that. These patients with undiagnosed diabetes oftentimes have delays of 2, 3, 4 years before their diagnosis becomes apparent. And these patients develop increasing complications because they're not receiving the same provider attention or attention from your care staff for support for diabetes. So, some people say they don't have the bandwidth, but I hope that it's something that every group would try to develop that bandwidth because this is a very important public health concern.
Well, thank you very much, Dr. Colangelo, for your time today, and we appreciate you sharing some of your experiences working on this campaign plank with our Together to Goal campaign participants. As a reminder to fellow participants, if you'd like to contact Dr. Colangelo to discuss implementation of the Conduct Practice-Based Screening Campaign plank at your organization, please email t2gmentor@amga.org. Check out our remaining Together to Goal Plank Mentor webcasts at our website to discover what other experts have done to improve diabetes care across the country.